Hello everyone and welcome back to Becoming Dentist. Today we shall be learning about the permanent maxillary central incisors. Now as you can see in this image, we have the maxillary arch. This is the maxillary arch of teeth and this is the median line. So the two teeth just besides the median line are called as the permanent maxillary central incisor as they are in the center. Now moving on, we have the notation systems, the different notation systems. So we shall see what are the numbers of the central incisor according to various notation systems. So for the universal system, we have number 8 and number 9. This is the left side and this is the right side. So the left incisor will be number 9 and the right incisor will be number 8. Now according to the FDI system, we have the number 1 1 and the number 2 1. 1 1 will be for the right side and 2 1 will be for the left side. Next we have the Palmer notation system where we will have the number 1 for the maxillary central incisors according to the respective quadrant brackets. So for right side we will write it as such and for the left side we will write it as such. Now moving on, we have the chronology of the permanent maxillary central incisors. So the first evidence of calcification of this tooth, when the tooth starts to actually calcify, will be at around 3 to 4 months. Now the formation of enamel of the central incisor will be completed at around 4 to 5 years of age. And then you must remember the eruption age. The eruption of permanent maxillary central incisors is at around 7 to 8 years of age. You must remember the eruption ages of all the permanent teeth. And the root formation is completed at around 10 years of age. Now moving on, we have the measurements or the dimensions. So first of all, we have the cervico-incisal length of the crown. Cervico means from the cervical to the incisal edge. Cervico-incisal length of the crown is 10.5 millimeters. Then we have the length of the root. This is the length of root from the apex to the cervical line, that is 13 millimeters. Then we have the mesiodistal diameter. The mesial to the distal side, this diameter is the mesiodistal diameter, which is 8.5 millimeter. Then we have the mesiodistal diameter at the cervix. This is the cervix. So the mesiodistal diameter over here is 7 millimeters. Next we have the labiolingual diameter. So from the labial side towards the lingual side, this diameter of the crown is called as the labiolingual diameter of the crown, which is also 7 millimeters. Now this is the cervical line, so this is the cervix, and the diameter, the labiolingual diameter at the cervix is 6 millimeters. Then we have the curvatures. So from the mesial side, this is the curvature of the cervical line. Now if we draw an imaginary line over here, so this is the curvature of the cervical line from mesial side, which is 3.5 millimeters. And on the distal side, this is the curvature of the cervical line. This is the imaginary line we will draw, and this is the length of the curvature, that is 2.5 millimeters. So the distal side, the curvature is 1 millimeter less than that of the mesial side. Now moving towards the general features. Now the maxillary central incisor is the most prominent tooth in the mouth. So whenever you smile or laugh, chew, talk or anything, the first teeth that will be viewed will be the permanent maxillary central incisor. So it will be most prominent teeth in your mouth. Now it is also the widest tooth mesiodistally. As you can see here, this tooth is very wide. Mesiodistally it is very wide. So it is the most widest tooth mesiodistally of all the anterior teeth. Now a newly erupted central incisor will have mamelons, as we studied in the lecture of general or the basics, that a newly erupted incisor will have 3 protuberances called as the mamelons. Now as you know, there are 3 mamelons. So the mamelon which will be in the middle or the center will be the smallest mamelon. Now lingually the crown is scoop-like. As you know, we have an ice cream scoop just like this. So from the lingual side, the crown will appear like a scoop. Now the maxillary central incisor is larger than the lateral and the meso-incisal angle is relatively sharp. This point we will be discussing in the labial aspect. So starting with the aspects, first of all we have the labial aspect. So from the labial aspect, the crown is trapezoidal in shape. How? Like this. See, this is a trapezoid. So the crown is trapezoidal in shape. Now as you can see from here, these are the two parallel sides of the trapezoid. So this is the smaller side and this is the larger side. So the smaller side is towards the cervical line. This is the trapezoid and the smaller of the two parallel sides is towards the cervical line. Now here this is the incisal edge or the ridge. So this will meet the mesial and the distal sides to form two angles over here. See, two angles. So this is the mesial side and this is the distal side. So here this angle formed is called as the meso-incisal angle and this angle is called as the disto-incisal angle. Now as you can see from here, this disto-incisal angle is a bit rounded while the meso-incisal angle is quite sharp. See, meso-incisal is sharp, disto-incisal is rounded. Now for the contact area on the mesial side, remember this is the mesial side, this is the distal side. So here as we know, we had the division into thirds. So the contact area for the mesial side will be in the incisal third. See over here, this is the incisal third. This will be the mesial contact area and the distal contact area will be over here at the junction of incisal and middle third. This is the mesial contact. This is the mesial contact area and this is the distal contact area. Now as you can see from here, this is the distal outline and this is the mesial outline. Now as you can see, the distal outline is slightly more convex than the mesial outline. Now the cervical line, this is convex and the convexity is towards the root. And the labial surface, as you know, will be convex and regular except two tiny depressions over here which are due to the junction, which are formed at the junction of the fusion of the lobes. Whenever these lobes will fuse like here, see, this place will have slight depressions on the labial surface. Now the root will be conical. As you can see, it is like a cone. It has a blunt apex. It is smooth. As you can see, there are no depressions over here and it is convex and it is tapering. Moving on towards the lingual aspect. Most of the characteristics from the labial aspect are similar in the lingual aspect also, except that from the lingual aspect, the crown is narrower. See, the crown is narrower. There is lingual convergence on the lingual side. As you can see, crown is narrower. So the outline of the crown is trapezoidal, shorter side towards the cervix. We have two angles, the meso-incisal and the disto-incisal angles. Meso-incisal is sharp, disto-incisal is curved. We have the same contact areas. So the mesial contact area will be in the incisal third and distal contact area will be at the junction of incisal and middle third. The distal outline will be more convex than the mesial outline. Now what is additional over here is that from the lingual aspect you will be able to see ridges. As you know, ridges are linear elevations. So the first ridge you will be able to see over here is the incisal ridge here. This ridge which you can see over here is called as the incisal ridge from the meso-incisal angle to the disto-incisal angle. Then we have two marginal ridges. So as the name suggests, this ridge will be at the margin. So this is the marginal ridge and this is the marginal ridge. Now this marginal ridge is on the mesial side. So it will be the mesial marginal ridge. And this ridge is on the distal side. So it will be the distal marginal ridge. Now as it is an anterior teeth, it will also have a cingulum in the cervical third, which is a convexity seen in the cervical third. Now if there is an elevation, it is very obvious that below an elevation there has to be a depression. So this depression that you see over here is the fossa, and as it is on the lingual side, we will call it the lingual fossa. Now if we trace it, you will be able to see it is W shaped or M shaped fossa, which is a characteristic of the central incisors. The root similarly is conical, smooth, convex and tapering. Moving on towards the mesial aspect. If we see the tooth from the mesial side, what we will observe is that the crown resembles a wedge shape or triangular shape. See, as you can see, you can clearly picture that it is triangular in shape. This is the base which is towards the cervix. Now the incisal edge. See, this is the incisal edge and this is the root apex. These two will be on a same line. If you draw a straight line, it will connect the apex to the incisal edge. Now outlines. So labial outline is very simple. It is convex, just like this. And the greatest convexity, that is the maximum convexity, is called as the height of contour. So if you draw a convexity like this, at this point the convexity is maximum. From here convexity decreases and decreases. So this point of maximum convexity is called as height of contour. So the height of contour for the labial outline will be at the level of cingulum. As you can see, at this point the height of the convexity is maximum. So that is at the point of cingulum. Now the lingual outline is a little bit complex because of the presence of cingulum. So here in the cervical third, as you can see, I am tracing it, it is convex. Now as we move further towards the middle third, it will become concave. And then again as we move towards this incisal third, it will become convex. So it will be convex, concave and convex again. The cervical line, as you can see, is convex and the convexity is towards the crown. See, this is convex. So this is the convexity towards the crown. The root similarly is conical, smooth, convex and tapering towards the apex. Now from the distal aspects, no differences are seen. It is exactly the same except that the cervical line is of a lesser curvature. As we saw in dimensions, the distal cervical line had 1 millimeter less curvature. All the things are same as the mesial aspect. Now moving on towards the last aspect of the tooth, that is the incisal aspect. So from the incisal aspect, what you can clearly see that the mesiodistal diameter is greater than the labiolingual diameter. So the tooth is wider. As you can see, the tooth is wider than it is long. Now from the labial outline, you can see here it is a clear convexity which is smooth. There are no depressions over here, no elevations. So the labial outline will be convex. Now the lingual outline, as we know from the lingual side, the crown will show lingual convergence. So the lingual outline will be narrower because of lingual convergence. Now the incisal edge or ridge, as you can see here, is horizontal and the root is not seen from the aspect. Always remember that in the anterior teeth, the root will never be seen from the incisal aspect. So whenever you are carving a tooth, always remember that the root should not be seen from the incisal aspect. So that is it for today's video. Thank you for watching. If you do like the video, please like it, share, subscribe and keep on watching as we keep on learning. Thank you.